Work in a microbiology laboratory involves a lot of handling and transferring of liquids in small, precise volumes. This is mainly done using pipettes. It is important to know how to use them properly so that you can make accurate volume transfers, reduce the numbers of aerosols generated, and prevent contamination of the pipette and subsequent cross-contamination of samples. Pipettes work by air displacement, and there are various types. Some are manual, others are electronic. Some have their volume control in the pipette itself. Others rely on the pipette tip to indicate the correct volume required. Irrespective of the type of pipette, there are some key operational techniques which will allow you to use them accurately and safely. It's important to note that mouth pipetting must never be carried out, due to the high likelihood of exposure to the potentially harmful materials being pipetted. Before starting any work, manufacturers' instructions should be read for appropriate use and decontamination procedures, including the different types of disinfectants to be used. Gather together the necessary equipment. You will need a container for discarded pipettes and tips. This could be a bin, box, a bag or a jar. You will also need absorbent tissue and an appropriate disinfectant to deal with spills and contamination of the pipette. You should have enough of the right pipettes and pipette tips for all of the work you are doing, and a few spare, so that you don't have to interrupt your work to fetch more. If the pipette has a filter, it should be checked for contamination and replaced if necessary. The pipette surface should be checked for contamination, and if necessary, it should be cleaned by wiping it with the disinfectant. If the pipette becomes contaminated during use, you'll need to carry out these checks and procedures again, or switch to a spare pipette and decontaminate the original one when the work is finished. For adjustable pipettes, where possible, preset them to the required volume before starting work, as this reduces the likelihood of pipetting the wrong volume of fluid. Make sure the pipette and container of the liquid to be pipetted are held such that your hands do not come into contact with the liquid. If it's not necessary to hold the container, then you should use a rack. When drawing the liquid into the pipette or tip, place the tip just below the surface of the liquid so that you can draw up liquid without drawing up any air. You should avoid getting liquid onto the outside of the pipette tip. As you can see, this adds significant extra material to the transfer, which will reduce accuracy, especially when pipetting small volumes. Draw liquid up slowly to avoid sucking up air. If the action is too quick, then you will trap air and probably contaminate the filter. Move slowly when transferring between two places. Try to make sure they are as close as possible to avoid the risk of dripping potentially hazardous liquids. Make sure that the pipette is held upright and not horizontally to avoid contamination of the filter and pipette. If the filter becomes contaminated, it will have to be replaced. Hold the tip just inside the container into which the liquid is transferred, and just above the surface of any other liquid in the container to avoid splatter, splash or aerosol. This also prevents any liquid that may be on the outside of the pipette tip from being transferred. Dispense the liquid from the pipette or pipette tip slowly. Because they use air displacement to push the liquid out, there is the possibility that if used too quickly, it could create an aerosol or splash. Eject the tip or drop the pipette itself, for example if it is a Pasteur pipette, carefully into the waste container. When the procedure is complete, check the filter and replace it if necessary. Wipe down the pipette with an appropriate disinfectant before putting it back in its storage place. Seal up and dispose of your pipette tip discard container through an agreed waste disposal procedure. Pipettes that have an integral adjustable volume control need to be calibrated at agreed time points, for example annually, to make sure that the volume set on the pipette matches the actual volume of liquid being transferred. This is often carried out using a pre-calibrated balance and water. 1 milliliter of water equates to 1 gram. A minimum of 3 samples of water at the minimum, maximum and an intermediate volume range for that pipette should be weighed to identify whether the pipette is measuring accurately. If the pipette is out of calibration, that is, the set volume and weight do not correlate, the pipette may be manually adjusted, or may need to be serviced by an engineer or disposed of. Pipettes that are inaccurate should not be used. In summary, good practice when working with pipettes includes no mouth pipetting. Have the right equipment to hand, including spare pipette tips. Check the pipette for contamination before, during and after use. Check the pipette is set to the correct volume before use. Hold the pipette vertically. Draw up, transfer and expel liquids slowly and carefully to avoid air bubbles, spills or aerosols. Dispose of pipette tips and other waste properly. Make sure pipettes are maintained and calibrated.